Hello, good morning, everybody. Hope we're having a good day already. Still on living with the pandemic. Please let's not forget to stay safe, maintain social distancing as much as you can. Please, please, and please wash your hands regularly with soap and water. Use your hand sanitizer. Use your face mask. The face mask is not for hanging on your neck. It's not for hanging on your head. It's not best left hanging, dangling from your ear. It's actually meant to cover your nose and your mouth. Please, let's use all those. Let's not get carried away. The lockdowns are all eased. Everybody's moving about now. So let's not get carried away forgetting that there is still a pandemic going on. Let's still remember that these numbers keep increasing. There has been no day the numbers went down. They keep increasing and people keep dying. Let's not be counted among those that were affected. Let the grace that has kept us so far keep keeping us. So I actually thought of something. I did my housemanship in Nnewi. Nnewi is a popular town in Anambra State. In Nnewi, there are, let's say, if there are 100 men in Nnewi, 80 of them are automobile spare parts dealers. 15%, oh no, that's too much. 10% are health workers, 5% students, and the other 5% doing other small business. That's to say that majority of men in the Navy are automobile dealers. Yes. So the trend I noticed was that towards the end of every year, towards the Ember month is the September, October, November, December, yes, the number of women that visit the gynae clinic triples. I mean, the numbers you see, you don't ever see them if you count the previous months all together. But in those months left to the end of the year, like, they keep coming in large numbers. And they all had one thing in common. They had one complaint in common: inability to conceive or trying to conceive. Now, if you go further to question these women, they make you understand that, this is Christmas coming and their husbands are coming back. They intend to conceive in this trip. The last time he came back, maybe that was Easter or August, and he spent about 2 weeks or 3 weeks, and they tried severally, and he went back and he was disappointed and nothing came out of the whole thing. So they want to check themselves and be ready to be sure. They go as far as asking you for drugs to induce ovulation, yes, just to make sure that once the husband comes back home this period, they conceive. And I'm like, madam, what makes you think you're the one responsible for the fact that you guys have not yet had a child? Don't you even take cognizance of the fact that it could also be the man's fault? But they're very far from it. Nobody even thinks towards that direction. As a matter of fact, in Nigeria, in Africa, Nigeria, amongst Igbos, any case of infertility or any couple regarded as infertile, almost all fingers point to the woman as being barren. If you go to the churches, the pastor announces the women seeking for the fruit of the womb. Meanwhile, this woman could be 100% okay, but then she still comes up to line up to receive prayers for the women seeking for the fruit of the womb, while the man that might have something wrong is out there doing something else. Now, when you say seeking for the fruit of the womb, automatically all hands are already pointing at the woman. She's the one carrying the womb, so definitely she's the reason why they don't have a child yet. But that's not the case. Like, okay, fine. Some men, those that are brought coming back. Now, there are men that live there in Nnewi Gogo, and they wouldn't even make attempts to come around to the clinic. Even when you ask their wives to come with them during their next visit, the man tells you blatantly that he's not responsible. Some even tell you that they've had a child before. Yes, they've had a child. They got the girl pregnant while they were still bachelors, And some even tell you that, someone tell you that I've gotten like 3 girls pregnant, so why is this being difficult? Definitely is not my fault. And I'm like, okay, fine, is the child alive? Have we done a DNA to confirm it's your child? How do you even know if this child is yours? I mean, okay, between now and then, can't anything have gone wrong? Why not come around, let's check you? But then it's a no-no for them. But I want to make us understand something clearly. Anybody can be responsible for infertility. As a matter of fact, the probability that a woman is responsible for infertility is equal to the probability that a man is responsible. Yes. Let me say this again. The probability that a man is responsible for infertility or for childlessness in marriage is equal to the probability that a man is, meaning that both partners could be responsible equally. So it's not blaming on one person or the other. The two of you. As a matter of fact, in couple A, the woman could be responsible. But in couple B, there's also a high chance that the man is responsible. So let's not make it a gender thing that is just for the women to go fix it, to go find out, to go take the drugs, to go do the test, to go drink the concoctions. No. It could be your fault, it could be her fault. And the earlier both of you come around, the shorter time and the lesser money people spend going from pillar to post. So please, anybody can be responsible for infertility. That's, by the way, what's infertility? Most importantly, let me even define what infertility is for you guys. In a very with a very clear definition that even the laymen can understand, because I'm educating the laymen particularly. Yes, everyone is listening to me, but I want this message passed more. Let it sink in. I want to pass in the medium that it could sink in to these ones that really have not much knowledge of this. So infertility is the inability to have a child or to conceive after 1 year of regular, unprotected sex. The duration should be 1 year, the sex should be regular, and it should be unprotected. You cannot have sex once a week in 6 months. That means you've had sex, like, let's say in 6 months, you've had sex 6 times, once a month, and then you tell me you're infertile or you guys are childless. The maximum you guys should have sex as frequent as 2 to 3 times a week. That's the least you guys should have sex. Targeting especially the week of your woman's ovulation. So when you've done that without protection, without use of lubricants, because some of these lubricants have spermicides that kill sperm, without vaginal douching for 1 year, then you can come for testing and treatment as a case of infertility. Now, most men don't even know they're infertile. The basic thing that this man just knows that my wife hasn't gotten pregnant, or those that can blame themselves a bit to say, I've not been able to get my wife pregnant. Then some other things he might notice they really don't know, but then some could notice that they're having problems with sexual intercourse. Yes, maybe problems with maintaining erection, or they're having erectile dysfunction, or then some even they ejaculate when doing sex. They notice that the volume of the semen ejaculated is quite small. Then some also notice pain or a lump in their testicles. Then some will notice that maybe lately they're having frequent respiratory infections or loss of smell. Those are like little things they could notice, but nobody points that to pending infertility. Then for some people, they could notice that maybe their hairline is receding, they're getting bald, even the hair distribution on their mustache, their beard is changing, even their pubic region, the hair pattern is changing. It's called androgenic alopecia. They start losing hair. some their voice changes, and then some start growing breast, abnormal breast growth, that's gynecomastia. So these are subtle pointers, but it's something you don't get to notice over time. Then again, there are causes for infertility in men. Broad causes of infertility in men. There's cause of it. There are many things that can cause, that can make a man infertile. Let's start from factors relating to the sperm first. Now, this man can be bragging, I can do this. I'm able to achieve erection for 20 minutes, for 40 minutes. But then, yes, he achieves erection and then he ejaculates. If the semen ejaculated is viewed with a microscope, you could notice that the sperms in the semen are not able to move fast. That is, they have poor motility. Now, even though some could be able to move fast, notice that some, they are not well formed. That's their morphology. They are improperly formed. They could have a big head, distorted tails, and all that. All these things could, impair fertility. Then also the sperm counts could be low. The volume is too small. Then we'll talk about infections. Infections like epididymitis. We'll talk about mumps-related otitis. In mumps, Igbo, we call it abukanti. Yes. Now that could also cause your testicles to shrink. Then we have sexually transmitted infections like gonorrhea. Maybe in the past a man lived a randy life, he had STDs, and it wasn't properly treated. Of course, they went to one corner and had 2 or 3 shots of wash and sets and bobonise, and they feel they're good, and luckily for them the symptoms revolve, but the effect on your reproductive organ is there. You could have scarred your urethra, scarred your male organs, that the sperm, even if when released, can't travel out to come out. So these are things that can happen in the course of infection. Then we'll have varicocele. Varicocele is when the vein draining the testes gets swollen. Now that could also cause infertility. Then we'll also have ejaculation issues. Yes. Now, normally when a man ejaculates, the sperm is supposed to flow out into the body of the female. Now, in this case, the man ejaculates, but the sperm flows back into the bladder. The bladder is where the urine stays, where you store urine until you're ready to wee. It's called retrograde ejaculation. If such things happen, there is no way you can get a woman pregnant except through assisted reproductive techniques. They will have some tubal factors, let's say trauma, injuries like fall astride. We have surgeries in the past like scrotal surgeries, hernia repairs. These are things that can actually affect fertility. Maybe they ligated, and the blood vessel supplying the testes was ligated, during the course of the surgery. Then we'll have tumors and cancers. All these things can cause infertility in a man. Then we'll look at environmental factors. The kind of occupation this man does, or like long distance drivers. These people, they wear tight fitting clothes and they're in a place for a very long period of time. Now the testis doesn't need all that heat. It doesn't. Or take a look at welders with all that constant light and all that, the kind of work they do, the place is hot. The testis needs a moderate temperature. Yes. So when you constantly soak yourself inside hot tubs, saunas, those things could reduce your sperm production. Then we'll talk about maybe exposure to chemicals like benzenes, pesticides, DDT. We'll talk about lead poisoning. Yes, all those things also have a role to play in infertility. They do. Frequent X-ray exposure radiations. Frequent exposure to radiations could reduce the level of testosterone, and this could go ahead to affect, the level of to cause reduction in sperm production. So then, okay, fine. Let's also look at the lifestyle of this man. Some of these men binge drink. When I mean binge drink, alcohol on a regular. Alcohol lowers your testosterone level. Alcohol causes erectile dysfunction. Alcohol reduces your sperm production. Don't get me wrong. There are men out there, there are alcoholics, there are drunkards that have 10 children. Yes, but it worked for them. It could not, maybe it doesn't work for you. Do you understand? Then smoking, use of drugs, steroids. You see these weight builders, they take all sorts of steroids to build their muscle. While they build their muscle, it actually shrinks their testicles, reducing their sperm production. Then obesity. Obesity in every way affects fertility. Yes. So you see that fertility can be caused by some things you can change by yourself, like your weight. You can lose weight, you can reduce your alcohol intake, you can stop smoking. These are things you can reverse. The irreversible ones, yes, there are some. Then the ones that can be treated by the doctors, they treat you. Then the ones that are irreversible, for God's sake, there are so many open ways to have a child now. There are assisted reproductive techniques, option of surrogacy, options of adoption. This is for the man. Now for the women, typically, a woman might not also know she's infertile. Yes, she might not know she's infertile, but then she knows that she has not been able to conceive. Or you ask her, since as a young girl, as a woman, she has never taken it mistakenly before. Then she could also notice that her menstrual period is abnormal. It could be abnormally long, that's greater than 35 days, menstrual cycle length, or abnormally short. The cycle length could be less than 21 days. This could be a pointer that maybe this woman is not ovulating. So this is just what she knows. And then if you now go to investigate further, you find out other things. But usually it's not spellbound on the woman's head, infertile. So there are lots of factors that can cause infertility in a woman. And the most important factors are ovulation factors. One in four infertile women, ovulation factor is the cause of the infertility. And the most common cause there is PCOS. PCOS is polycystic ovarian syndrome. Now this presents with hormonal imbalance, obesity, insulin resistance. Now this woman is obese. She has abnormal hair patterns on her face and parts of her body, and then she has acne. Yes, it's the most important cause. So you see them, that's also a factor. They'll have primary ovarian failure. Now in this case, the woman's ovary stops to produce egg before time, even before menopause, before 40. Now when this happens, there's reduced estrogen production. This woman can get pregnant. Then the hormones responsible, the hormones produced by the brain that helps in fertility, that's the follicle stimulating hormone and luteinizing hormones. These hormones are not formed in adequate quantities. Thereby you also see estrogen reduction. Then we also talk about prolactin. Most women come with it. They'll tell you, doctor, I noticed that breast milk comes out from my breast, but I'm not breastfeeding. When this is happening, at the same time is decreasing your estrogen level. So these women are not able to get pregnant. That's for the ovulation factors. Then we'll have factors related to their tubes. That's the fallopian tubes, I'll call them tubal factors. Previous PIDs, pelvic inflammatory diseases, particularly from past sexually transmitted diseases that were not well treated. We have chlamydia, we have gonorrhea. You see, these things, they keep playing up. Now this happened, you took one course or two courses of antibiotics and the symptoms resolved, and then that was it. And now this goes ahead to mess up your reproductive organ, forming adhesions here and there. Then we have, aside the pelvic inflammatory diseases. We also have what do they call it? I mentioned pelvic inflammatory diseases. I mentioned pelvic tuberculosis. We have endometriosis, yes, whereby uterine tissues are growing in other parts where it's not supposed to grow. Then we can have tumors. We have tumors and cancers. Then we also have uterine factors. Now for the uterine factors, we have fibroids. We have typical. Now let's get this right. Some women actually get pregnant with fibroid. Some, but unfortunately some don't. Some of these fibroids come and occupy the place whereby implantation is supposed to take place. This woman can't, and then we have still endometriosis. Then what again? We have now some people from birth, they have uterine abnormalities, maybe malformed uterus or malplaced uterus, stuffs like that. Now all these things can cause infertility in a woman. Then when we talk about lifestyle too, alcohol, smoking, weight plays a role too in women for fertility. Now some women are overweight while some are underweight. So in both cases, the both could have a contributory factor to infertility. So when you're working on some women go all the way down, they get anorexic and they're so skinny. Now this affects your fertility too. Now, so you see, there are lots of factors affecting both men and both women. You can't say categorically it's me or it's her. What basically the two parties need for the causes that they can address by themselves, like the weight, the woman should ensure she maintains a healthy weight. She shouldn't be underweight. She shouldn't be overweight. They should avoid alcohol at all costs. Avoid tobacco. Stay away from anything, all these environmental factors that I mentioned, chemicals that could impede or that could affect your fertility. Then limit caffeine intake. Caffeine is not good. Excess of it can affect your fertility. So you at least limit it to like less than 200 milligrams. That's about 6 to 8 ounces. So 1 to 2 cups, 6 to 8 ounces in a day. These are things you can help yourself live a healthy life. Then see your doctor when it gets to that 1 year, you guys are doing all you ought to do and you're still not able to conceive. Then see your doctor. There are so many ways the doctor can help you. The doctor can test you guys and find a means to address your problem. If it involves artificial techniques or assisted techniques, he can also help you guys with that. Infertility is not a death sentence. Don't let anybody put you under pressure. And mind you, there are couples that decide on their own not to have babies yet. Some give themselves 5 years after marriage. Yes. Some give themselves 4 years after marriage. Some have their first kid and say 4 years later they have the next. It's their choices. So you don't start putting pressure. Moms, dad, in-laws, uncles, aunties, please don't put pressures on anybody. It's hard already. The society makes it hard. So all you need to do is to support. If you see a couple going through infertility, if you have good counsels or good, you could drop them, but don't put pressure, please, because pressure adds to stress, and stress is also a cause of infertility. Emotional stress, that because you stress them emotionally and you stress them psychologically. So just let them be. If you have good references, good hospitals, fine, but don't push it. And for the couples involved, please keep yourself at peace. Reduce stress to the minimum. Regularly have sex with your wife. If it's not working, see your doctor. Give it time. Take your drugs. Go for any techniques suggested. If you guys want to try surrogacy, that's fine. If you want to try adoption, that's fine. But please, I beg you, leave Mama Yard alone. You see Mama Yard? Mama Yard, please leave her alone. Have a good day, everybody. Thank you.